Going for an EEG, a social story for my visit at Brain Treatment Center. Soon I will go to the Brain Treatment Center. When we get there, we will wait until it is my turn. It may take a few minutes. I can play with toys, color, or read a book while I wait. The technician will come and take me into an EEG room. They will have me sit in a chair. The technician is very nice. They are here to help me. First, they will wrap a chest strap around my chest. Arms up. Next, they will clean 3 areas with a wipe. My forehead, my ears, and my chest near my heart. They'll put a sticker on my heart too. The technician will put a hat, like a swim cap, on my head and clip my hat to my chest strap. Then they will put clips on my ears. This might feel like a small squeeze, and that's just fine. They will put gel in my hat in 21 different places. It can feel like a pen twist and turn on my head. The gel can feel cold, and this is okay. Now the technician will turn off the lights. I just have to close my eyes for 10 minutes. Careful not to fall asleep. After they take off my hat, my hair may be a little wet. I am all done for today. I may come back to visit soon. See you next time.
Hello and welcome to the Autism One 2020 Virtual Summit. I'm Eric Nansteel, and I have the pleasure of introducing to you a panel discussion by Sandy Lee, MD, and Alex Ring. The discussion is called A Review of Non-Invasive Neuromodulation and Its Effectiveness in Autism Spectrum Disorders. Sandy Oak Lee, MD, FAAP, is a board-certified pediatrician and fellow of the American Academy of Pediatrics. Dr. Lee graduated cum laude from Cornell University with her bachelor's degree in biology. She then received her medical degree from New York Medical College and completed her residency at Children's Hospital, Los Angeles. In 2016, after 15 years in community private practice, Dr. Lee joined the Brain Treatment Center as a medical director of the Newport Beach office, where she oversees the clinical care of patients. As a physician humanitarian, she enjoys volunteering her time and expertise abroad in Mexico, Central America, Asia, and Africa. Dr. Lee was selected as America's top physicians by the Consumers Research Council of America in 2013 and was a recipient of the Orange County Physician of Excellence Award in 2014 and 2015. Alexander Ring has participated in the exploration and development of novel brain imaging and brain stimulation technologies throughout his career. He discovered and characterized neurological markers for various psychiatric and neurocognitive disorders at UC Irvine's Center for Neuropsychiatry. In 2009, he joined Newport Brain Research Laboratory and Brain Treatment Center, where he developed and advanced the administration of non-invasive EEG and EKG-guided brain stimulation. In 2019, he joined Wave Neurosciences as senior scientist to further research and development of multimodal brain stimulation and imaging technologies. Alex interfaces with neurologists, pediatricians, psychiatrists, and specialists at clinics delivering brain stimulation in the United States and around the world. He is engaged in clinical trials with these brain stimulation technologies, serving as an electrophysiology specialist in pilot studies, double-blinded studies, and FDA-grade trials. Alex is interested in furthering insights into brain function and innovating therapeutic treatments that impact populations on the global scale. Their talk is described as a wide array of non-invasive neuromodulation technologies are being studied for the treatment of autism spectrum disorders. This discussion will cover several technologies, including transcranial direct current stimulation, TDCS, photobiomodulation, and magnetic EEG-EKG resonant therapy, MERT. The effectiveness of these technologies on brain function will be reviewed. Highlighted will be updates on the clinical responsiveness of personalized neuromodulation, MERT, in children with autism.
Welcome everyone to Autism One. I am super grateful to be a part of this very unique virtual conference during this especially challenging COVID time. We have so much amazing information to share with you, and I just hope that it is just life-changing for you and your family. Welcome again. Hello everyone, and welcome to this virtual talk on neuromodulation and its role in autism spectrum disorders. I hope that everyone is doing well wherever you are Zooming or streaming in from. Now, my name is Dr. Sandy Lee, and I am a pediatrician in Southern California. Several years ago, I was introduced to the Brain Treatment Center and became intrigued with the research that they were doing, so much so that I found myself joining their team. I'd like to take this time with you to share about the work that we are doing here, especially in regards to how it is impacting those with autism. Today, I will be joined by my colleague, Alex Ring, our senior scientist, who will be speaking on neuromodulation, and by Miriam Gamal, who will share her own personal experience at the Brain Treatment Center. Before I go any further, I do have to say that I have no financial interest or affiliation concerning materials discussed in this presentation. Now, the Brain Treatment Center is an outpatient clinic with the mission to provide innovative medical technologies, specifically brain science technology, to restore regions of the brain to optimal neurological function using non-invasive neuromodulation. In other words, we are looking at novel ways to improve brain function non-surgically. We have several locations in the US and internationally, and we have the privilege to be in collaboration with multiple organizations, including the USC Center for Neurorestoration, the Department of Defense Collaboration, and the United States Operations Command. So what exactly is it that we do at the Brain Treatment Center? What we do is called magnetic e-resonance therapy. We call it MERT for short. And this little e is really important because it stands for EEG, EKG guided, which is a key component of the individualized protocol that we provide. And I will be talking about this shortly. Now, just to give you a little bit of a background, this next slide is our bubblegum colored image of the brain. It's so pretty with all the colors, but it diagrams the different regions of the brain and those different functions. Of particular interest in those with autism is the frontal lobe activity. And this is the region of the brain that's responsible for higher executive functioning, such as problem solving, creativity, language, and emotional regulation. On a microscopic level, the brain is composed of approximately 100 billions of neurons. And these neurons are specialized cells that are designed to transmit information from one cell to another through electrical impulses called action potentials or firings. And an action potential is generated by a change in ion concentrations across the cell membrane with the movement of positively and negatively charged ions through ion channels. One way to characterize brain activity is to describe how many times these neurons are having action potentials per second. In other words, how often are neurons communicating information to one another per second? On this graph here, what we're looking at is the different categories of neuronal activity based on the frequency of those neurons having action potentials. If you look down here, this one box here represents 1 second. And every peak that you see here, this is an action potential that's being generated by neurons. And you can see down here at the bottom of the screen here, we have very few peaks. We only have like this one big one. Versus up here, we have multiple number of peaks in that 1 second. And we have a lot of different categories. This delta wave, this is describing neurons when they are having anywhere from 1 to 4 action potentials per second. And this is usually the dominant kind of activity that we see when you are in deep sleep. Theta waves, these are neurons, the activity that occurs between 4 to 8 times per second or 4 to 8 hertz. When we are in that drowsy in and out of sleep state, we tend to see neurons communicating with one another through action potentials at this rate. If we go up here, this is the alpha activity. When you are awake and alert with your eyes closed, you should have predominantly 8 to 13 hertz activity in your brain function. And when you're awake and alert and engaged in activities, you should have much faster activity, greater than 13 hertz or 13 action potentials per second. And those can be categorized as mu, beta, and gamma waves. Now, intuitively, this should make sense because one would think or expect that your brain's activity would be slower in deep sleep, for example, versus if you're in a very highly demanding activity or situation. Now, in addition to neuronal frequency, we also look at global brain activity. Are all parts of the brain functioning at a similar rate, such as we see here on the left of the slide here? Or are some parts of the brain operating at a much faster frequency and some at a slower one? And oftentimes, if there's a disruption of this global synchrony, this can disrupt optimal brain function. When using MERT, the magnetic stimulation that's applied to specific regions of the brain, our goal is to improve the frequency of neuronal activity and global brain synchrony. Now, there are 4 basic steps in the MERT treatment process. First, we obtain a baseline EKG, EEG to evaluate the brain wave activity, heart rate, and brain-heart coherence. This data is then analyzed by our EEG team, and a protocol is created. The patient then comes in for daily treatments, and lastly, a repeat EEG is done every 2 weeks or so to evaluate for EEG changes that are occurring and to modify the protocol as needed to keep up with the brain changes. This here is a video recording of an EEG being taken. As I mentioned before, the actual recordings are obtained in the resting awake, eyes closed state when neuronal communication should be occurring at a single intrinsic frequency between 8 to 13 times per second throughout the brain. Now, our adult volunteer here is being very cooperative during the recording and the preparation, and you may be watching this wondering, how is my child with autism going to be cooperative enough to get an EEG done? Thankfully, we have a great staff with a lot of experience in working with autistic children and adults. And at our Newport Beach site clinic, we have obtained multiple EEGs on over 600 patients with autism and over 1,500 patients in our different clinics worldwide. Now, with the quantitative EEG data, the brain's electrical activity is analyzed. In particular, is there alpha activity? At what intrinsic frequency is it occurring at? And is it consistent or synchronized throughout the brain? Oftentimes, patterns can be identified. For example, in our autism population, we often see a disruption or absence of synchronous alpha activity in the frontal lobe region. With the EEG data, an individualized treatment protocol is created. In particular, the location and frequency of magnetic stimulation is determined based on the EEG, EKG data. And this is important. So regardless of a person's age, gender, or diagnosis, whether you have a level 1 or level 3 autism diagnosis, or whether with that you have ADHD or sensory processing disorder, your treatment protocol is solely based on your own unique brain activity. And that is why that little e in MERT is so important. We don't just provide magnetic resonance therapy, we are providing an EEG, EKG guided magnetic resonance therapy individualized to you. And when you think about it, this should be the case. Even though two kids can have the same autism diagnosis, they can be very different in their behaviors and development. So it should be expected that their brain treatment protocol would be unique to each of them. Here's a recording of the MERT treatment. Our volunteer, again, very cooperative, is able to sit under the fixed coil arm during the duration of the treatment. In individuals who are unable to sit still, the technician will manually apply the coil to the designated location for the several second bursts of stimulation. And this will be shown in a later video. The several second burst stimulation occurs approximately every 45 seconds over a period of 30 to 40 minutes. And it can be done in one location or two locations, just depending upon your individual protocol. The stimulation feels like and sounds like a tapping sensation. It's not supposed to be painful or uncomfortable. And some of our individuals actually describe the stimulation as being quite relaxing. Now, with MERT, where we're helping to develop and initiate movement of the alpha activity towards the individual's intrinsic frequency, repeat EEGs are obtained every 2 weeks to monitor progress and adjust the treatment parameters as indicated. Symptoms tend to improve once the alpha waveforms develop and are synchronized. In our children with autism, parents usually report improvements within the first 1 to 2 weeks of treatment. Changes are more durable after 6 to 8 weeks of MERT treatment, and the duration of treatment varies from individual to individual and is based on observed EEG and clinical improvements. Now, with all things in medicine, there can be side effects. Thankfully, with MERT, the side effects are minimal. They can include mild headaches, which can occur after the first few days of treatment and usually resolves in 1 to 2 hours on its own. I kind of liken it to when you go to the gym and you start working out, your muscles are sore for those first few days, and then they become acclimated to the increased activity. Similarly here, you can also have transient emotional lability and excitability, but you can also have fatigue. Because brain activity is being stimulated, there is a risk of seizures, anywhere from 1 in 100,000 to 1 in 500,000 individuals. I know that when seizures is mentioned as a possible side effect, this can raise a lot of concerns. But just to give you some perspective, this is a Game Boy safety information label for seizure warnings. And here it says that some people, about 1 in 4,000, may have seizures or blackouts triggered by light flashes or patterns, such as while watching TV or playing video games, even if without a prior history of seizure activity. So even things like video games can put you at risk for seizures. Now, because the MERT stimulation is magnetic in nature, there are some contraindications to using MERT. Thankfully, most of these are not seen in the pediatric population, but includes the following that we see on this slide here. And the only one that I've really seen in kids, I've had maybe just a couple come in with a history of a VP shunt. There are also some relative contraindications for MERT. Individuals with these relative contraindications are reviewed on a case-by-case basis for treatment eligibility. Now, I want to go over a few patient examples with their EEG changes during their treatment course. Just to give you some background information, this here is kind of what we see in expected EEG rhythm with global synchrony. So on the left here, you see a summary of the front, middle or central, and posterior or back of the brain's activity. Note that this is the frequency along the x-axis here, and we're looking at the frequency of neuronal activity or those action potentials or firings. On the y-axis is the amount of electrical activity that's being recorded. It's unlabeled here in this case. And the area under this line represents the neuronal activity that's going on at this different frequencies. And I highlighted, or I marked this red box here. This is the alpha range, at 8 to 13 hertz activity. And here you see for this individual has a nice intrinsic alpha activity, a little bit over 10 hertz, pretty well synchronized from front to back, as you can see by just how the peaks all line up here. Now, in contrast to this, we have an EEG report from a child with autism, and that's to the right here. And the expected one is I put here on the left. And note for the patient with autism, you do have some alpha activity just around 10 hertz in the back of the brain. You have some of it centrally also, but notice the difference in terms of just the amount of activity you have in the frontal part of the brain in a child with autism. And this is the pattern that we often see with kids with autism, is that they do have minimal or smaller amounts of frontal alpha activity compared to back of the brain activity. And instead, you have a lot more of the slower delta and theta 1 to 8 hertz activity going on. And so with MERT, the goal is to increase the neuronal activity between that 8 to 13 hertz to nudge some of these neurons that are operating at a slower activity to essentially speed up so they can have more of that alpha activity in that central and frontal regions of the brain. Now, you may be wondering, is this possible? Can we really modulate or affect brain function? So let me give you a couple examples of patients that we've seen here. This is a 7-year-old who came in with autism. His baseline EEG is shown on the left here. And again, summary of the front, middle, and back of the brain activity, the amounts of electrical activity that's being recorded on the y-axis, and again, the frequency of neuronal activity in hertz here. Coming into our clinic, you can see that he has some degree of alpha activity posteriorly, some of it centrally, not as much frontally. You can see there's a lot more of that slower activity. And you can see over the course of 4 weeks, he really started to have some nice alpha activity that started to be more synchronous front to back here. And again, here he now has a much more dominant alpha activity at around 8.5 hertz. Clinically, this patient did really well. He had improvements in his social interactions, his eye contact, his imitation, and decreased hand flapping. He also started to use longer phrases in his speech, and his parents actually brought him back the following summer just to get additional treatments to continue his improvement. This next slide I like because it demonstrates the neuroplasticity and change in the brain even in an older individual with autism. This is of an 18-year-old patient who came in to see us. And again, just looking at his baseline EEG here, you can see he has some degree of alpha activity posteriorly, but really not much to be characterized in the central and frontal part of his brain. He had a lot more of the slower activity that was dominating. And you can see over the course of time, he started to really just develop this some activity here a little bit faster than that 8 hertz activity. And so it had some nice developments in terms of creating some more of that alpha activity. Clinically for him, he came to us just very, very aggressive and combative. During the course of the treatment, his aggression and physical combativeness really, really diminished. He became calm. He even was showing affection to his family. He was able to just follow instructions to the point of learning how to swim while he was out here during his course. Okay, here we have a video of another 18-year-old with autism. These are some of the symptoms that he was exhibiting. And here is you'll see the mom's positioning in this recording.
Stop her. Just relax. Build.
Featured just some of this unpredictable
Build now.
behavior.
Build now. Stop it.
And this is here looking at the treatment.
Here we go, Kelly.
The stimulation assembly and have the stimulation already in place, the designated location. And after 1 month of treatment, we saw some really nice changes for him.
Good job, Kelly.
Being able to engage.
Dribble, shoot. Oh, dribble. Whoa.
Red dot.
Just seeing an improved quality of life for him and his family. So, as some of the benefits that we've seen in our patients that have come through with autism, we've seen improvements in just different areas of their lives, from their sleep to their eye contact and comprehension, their ability to just follow instructions, their social awareness, and even in their communication, both non-verbally and verbally. So as I wrap this up and as I conclude, I'd like to introduce my colleague, Alex Ring, as he discusses the role of neuromodulation. And I will be available at the conclusion of our joint presentation for any questions, and I look forward to speaking with you.
Welcome everyone to the Autism One virtual summit. This is real exciting to be able to
do virtually and connect with everyone virtually. It's a shame that in-person got canceled, but I'm really excited for all the content, all the speakers, all the guests, and all the information that we're going to be able to still be able to work through. It's real important, and it's important that it's accessible to everyone, I think.
Hey, Alex, how
Hey,
are
Miriam.
you? So excited to see you. Well, you know what? I think we need to make the most of it. I'm an autism mom, so I live by that motto. Let's just take it one day at a time and make the most of it. And you know what? So many more of you are actually going to have access to this because it's online. Not all of us can just pick up and go to Chicago and see it in person. So let's just take this opportunity to do this together. And so many more of us are going to be able to see all these great tools that are out there for our children that otherwise we wouldn't have been able to see. So I invite you all to come and listen to our presentation for Brain Treatment Center and see how this amazing technology changed my autistic daughter's life.
Thank you, Sandy, for covering the initial portion of our presentation, just talking about some of this brain stimulation in autism. My name is Alexander Ring. I'm a senior scientist for Wave Neuro, and I'm going to cover a little bit more on the science of neuromodulation, just in general, specifically looking at what we're doing on this individualized, personalized MERT side of the house, but also from a background as far as why we even want to look into this. So, as I said, I'm associated with Wave Neurosciences. We're a company that looks at and analyzes brainwave activity, EEG activity, in patients that are coming into to clinics worldwide. And we're going to talk a little bit about neuromodulation. So, I am an employee of Wave Neuro. It's my disclosure. And one of the questions we need to ask when it comes to neuromodulation, brain stimulation, is why even approach it approach trying to treat autism from this perspective. And this comes contextually, we want to look at and ask the question, how are brain cells working? How's our brain tissue functioning, such that we want to introduce some stimulation or even look and address it. And when we start asking questions about the brain, we want to know how it's working. And depending on the period that you're looking at, if you're looking at someone with their who's sleeping versus someone who's awake, who's active versus having their eyes closed, we'll note that we find different types of function. Our brain cells talk differently. That is similar to what you might expect when we're sleeping. Brain cell activity is really per second. Brain cells are firing and resting, or essentially talking as a whole. They talk or fire and rest very slowly when we're in deep sleep. Now, when it comes to being more so awake, that activity is faster. Beta activity, alpha activity. So these faster frequencies, they're occurring not when we're asleep, but when we're awake, when information is coming in, and our brain has to deal with the incoming sensory information, sight, sound, taste, touch, smell, balance, temperature, pain, proprioception, all these things. So a lot of information, and we'd like our brain to be present awake instead of being in this deep sleep state. You'll see there's also something called theta activity, which is between these alpha and beta ranges. And that's sort of the pit stop our brain takes as we fall asleep and go into deep sleep. So for these different types of brainwave activity, contextually, we're looking at this, and these different states correspond to different levels of activity. And as I mentioned before, we want to be present and awake. We don't want to have sleepy state activity. We tend to focus on activity in this range right here. It's called alpha. I like to call it our brain clock. And the reason I call it our brain clock is because it's associated with sensory perception, understanding, and it's essentially the speed at which we're updating ourselves every second. You know, it says 8 to 13. That's the number of these brain waves in a second. About 8 to 13 updates per second is what's happening. Just to give a little bit more context there was a little experiment that was done in 2015, and this is just a little visual abstract of that experiment, where they showed patients, just participants, took them, 10 of them in a room, and they showed them 2 flashes of light, flash 1 and flash 2, and they asked the participants, how many flashes do you see? And these were pretty fast flashes. This is 20 millisecond, or 20 flashes in a second, just 2 of them. They asked this question, how many do you see? Some said 2 flashes, some said 1 flash. And then they had them close their eyes, and they went ahead and they listened. They listened for these different brain waves, and they found that this brain clock activity, this alpha rhythm, is what they were seeing, and they counted how many peaks or how many brain waves or how many times per second brain tissue is firing and resting. And they found that the group that said, I see 2 flashes, had more than 10 of these brain waves in a second. And the group that said, I only see 1 flash, had fewer than 10 brain waves in a second. So the speed of this oscillation, the speed of this firing, is corresponded to how quickly we're updating information about the world around us, which is really important because when we start looking at the brain as a whole, looking at the entire cortex, this information, when it comes to sight, sound, taste, touch, smell, etc., it needs to travel from areas where we're receiving information to areas where we're putting it together, from posterior to anterior, from back to front. And you can think of it kind of like a radio frequency. That is, if I want to tune into a radio station and let's say I want to listen to 98.7, and I tune instead to 98.5, well, I might get a different station, I might get static, and it's not really conducive to me being able to just comfortably listen to the radio. So the model, when we're looking at this brainwave activity, we take these EEGs in our clinics on children all the time, is we're hoping to find that when it comes to what's happening in the back of the brain, that it's similar as far as the speed at which information is being updated or this brainwave activity is oscillating or how fast it's working. We want these 2 different regions, posterior and frontal, to line up. You can see in this example of what I might call more neurotypical, we do see the same frequency over time. This is time left to right. So for a period of maybe half a second, back and front are both firing, resting at the same moment in time. Whereas what we find pretty regularly when we start looking at autism or in some of the other disorders that are disruptions that come through our clinics is there might be a posterior rhythm that is as expected with a certain number of beats per second between this 8 and 13 hertz range. But when we go to frontal regions, we might see that there's a little bit of disconcordance here or a different frequency. Maybe the frequency is too fast, or we see excessive slowing, or we don't see enough of this very same rhythm in the front as what we see in the back. And that's very much like this radio frequency being dissociated, where we have information coming into posterior regions, but when it comes to frontal, things are not necessarily connecting. So it's this activity, this brain clock activity, that we're measuring in every patient who's coming through the clinics with the EEG, and we're trying to understand to what extent tissue is working the same way as other tissue, and if it really can put the appropriate information together at the appropriate rate. And this is also reflective in a way of kind of something called metabolism in the brain and how efficiently brain tissue is able to work, is another thing that a healthy brain clock rhythm is really indicative of. Just as a side note, this develops between age 2 and 4, and it then speeds up after you develop this. So we all start a little slower at about 7.5 to 8 of these brainwaves per second. Then as we age and as we develop, it speeds up to a critical fastest frequency. Some are up at 10, some at 11. And then with age, it slows right back down. And that's when we see cognitive decline. And this is something where also if we have a head injury, we'll know that this is disrupted. We'll see slowing. The findings I'm talking to you about in terms of autism, they are also replicated when it comes to EEG studies in looking for abnormalities or differences between groups of children who have ASD or on the spectrum versus those who are not in terms of controls. So this is a little study that looked into 1,300 subjects and noted this disconcordance, and it's called coherence, but coherence is just a pocket way of saying how well front and back is talking to one another is not what we might expect to or like to find. Now, this disruption is something that we interact with from the neuromodulation side of the house. Neuromodulation, just short for brain stimulation. And there are different types of neuromodulation, from invasive to non-invasive to electrical. I'm going to go ahead and show a video right now. This is Andres Lozano, the next slide. And he's a famous neurosurgeon who, as he'll show you, conducts these implants electrodes into the brain and provides stimulation invasively. So we're going to move over there.
This, when it's in the brain, you see the electrode going through the skull into the brain and resting there, and we can place this really anywhere in the brain. I tell my friends that no neuron is safe from a neurosurgeon because we can really reach just about anywhere in the brain quite safely now. Now, the first example I'm going to show you is a patient with Parkinson's disease, and this lady has Parkinson's disease, and she has these electrodes in her brain, and I'm going to show you what she's like when the electrodes are turned off and she has her Parkinson's symptoms, and then we're going to turn it on. So this looks something like this. So the electrodes are turning off now, and you can see that she has tremor.
Not with the right inside. I can't. Can you try to touch my finger? That side's a little better. That side is better.
We're now going to turn it on. It's on.
I just turned it on.
And this works like that, instantly. And the difference between shaking in this way and not is related to the misbehavior of 25,000 neurons in her subthalamic nucleus. So we now know how to find these troublemakers and tell them, gentlemen, that's enough, we want you to stop doing that. And we do that with electricity. So we use electricity to dictate how they fire, and we try to block their misbehavior using electricity.
All right, so Andres, Dr. Lozano, he just demonstrated the application of this invasive form of neuromodulation. This is not what Dr. Lee was covering, but when this came about, that you could implant an electrode in Parkinson's and essentially override some of the behavior of tissue, it's of course groundbreaking, and it's to an extent became standard of care for Parkinson's. However, a good portion of those who are eligible for this procedure don't opt to have it done due to its invasiveness and due to the fact too that it might not last for long periods of time. But this is the invasive form of neuromodulation, where there's fantastic results. We know that if we can change neural behavior, we can really influence function, but doing so by implanting electrodes and getting deep is something that's not really practical on this larger scale. There are other forms of neuromodulation that are not invasive. These are non-invasive forms of neuromodulation right here. And these are forms where electrical stimulation is delivered transdermally. This is vagal nerve stimulation on the left. It's used to supposedly help calm down the sympathetic parasympathetic nervous system by stimulating the vagal nerve. There are tongue stimulators, and these deliver electrical stimulation that is supposed to hit your glossopharyngeal nerve to help with movement, trigenital for headache. This is a tumor treating field that's used to treat inoperable brain tumors. It extends the duration of life by about 3 to 4 months in patients with GBMs or glioblastomas. And just in context what we were talking about before with brain cells firing and resting these brain waves, what is really happening here is charge is being delivered to the skin, but the goal is to have that move across the skin into whether it be nerves or neurons and make it so that they fire more often or they fire less frequently. Remember, it's all about frequency or the speed at which everyone's firing. So a more popular technique we're seeing now a little bit more often is TDCS, TACS. This is direct current stimulation, where electrical stimulation is delivered via a sponge connected to your head. Unfortunately, the scalp resistance is really, really high, so the amount of charge really getting into your brain is negligible. However, the goal is still to bring neurons closer to firing or further away from firing. So in essence, this is our action potential, and there's a threshold here. Above this threshold, this is when a brain cell fires, and below, this is when it's prevented from firing. So the application of this electrical stimulation, basically hook it up to a battery, put it on your skin, is to bring neurons closer to depolarization and firing or further away from this. Now, some of the pros, it's lightweight and inexpensive, but once again, it's very difficult to measure the effect, and it's still very new. Dr. Lee had mentioned MERT. This is a variant of transcranial magnetic stimulation. This is where we are generating a magnetic field that we know penetrates a couple of centimeters into the scalp, into the cortex, the outermost layer of the brain, and it has a lot of different settings to it as far as how fast you can treat, the power, the dosage, and this is just a graph to show it does get into cortical tissue, and we know that we are stimulating that cortical tissue. So as an overview, we're talking about the speed of this oscillation, how there might be the disconcordance I was talking about before, where some neurons might be slower, some might be a little bit faster, deliver stimulation, and we then can measure how this happens over time. The EEG disruptions I was talking about before, we can visualize. So this is just a little series right here for different types of cases. On the far left, this is for frontal, central, and posterior portions of the brain. We can take an EEG scan, and we can count how many brain waves there are per second. And if there are 10, we'll see a peak near 10. And if there are 11, we'll see a peak near 11. If there are 10 and 11, we'll see 2 peaks. But what we expect to find is this brain clock, this radio frequency in the brain that helps us conduct information, is the same in the back as we see in central and frontal regions. There's one peak, it lines up, and it's the same speed, so we're not dropping any frames. Here we see what we might find in a patient coming into our clinics with concussion, where they have in the front of the brain a slower frequency downstream of the injury. So they're taking information in, but they're not able to keep up with it. We see that in addiction and opiates. Interestingly enough, when we look at autism, we might find that this rhythm is disrupted everywhere in the brain. Usually it's just in frontal lobe regions, but it could be everywhere. So our goal here is to take that EEG and to specifically guide therapy settings to be individualized to that person's brainwave activity. Here we see a patient at baseline. This is a child with autism prior to treatment. We administered treatment over the course of about 2 weeks, and these are daily sessions, 30 minutes a day. They sit in the chair. You can see they close their eyes. Feels like tapping. And after 2 weeks of treatment, very interesting increase in this activity globally. So we can actually now visualize the growth and recovery of cortical tissue and its function. These are a pair of twins and their progression from baseline to after treatment. And what you can see in a nutshell is at baseline over here for this twin, he starts off with very little of this activity globally. We want to peak at around 10. And after treatment, that grows. So we're seeing the recovery of this function. Same with his brother, the increase in recovery. And with this pair of twins, both reported improvements in cognition, language, attention. Essentially, they're now more able to harness and understand incoming sensory information. I'd like to show you one case real quick before handing it over. The patient before and after 2 months of this guided
And then they had to go, they went on vacation, they went somewhere. And if we do miss one or if we miss too much, we usually just add another one to the end.
Before, we have some stimming. And after treatment.
That's not a T, it's a D. Kid. Good boy.
Rat, good boy. Good boy.
When?
So by this time now we've looked at thousands of these cases, and we're very excited about the response that we're seeing across the board. This technology is hosted in these brain treatment center facilities. I'm going to go ahead and now hand this over to Miriam Gamal, who's mother of one of the children who's gone through the therapy, and she's going to talk through her experience and what she observed in her daughter.
Hi, everyone. Well, first of all, thank you for giving me this time to tell you the story of my daughter, Raquel, and how MERT, at the Brain Treatment Center changed our lives as a family and her life as a child with autism. Raquel has 11 years old. She's 11 right now, but when we first went to BTC, she was 4.5. She was diagnosed early on with severe autism, and the way, it was very easy to see that she was autistic because she wouldn't look us in the eye. She wouldn't listen to her name. She wouldn't turn around. Even if we were screaming right at her ear, she wouldn't look at us. She was nonverbal. She was almost 5 years old, and she had never said not one word. Her emotional connection to me as her mother was non-existent. She had no emotional connection to her sister, which is her twin, or her father. It almost felt as if she didn't care who we were or didn't understand who we were. And I think the most painful of her symptoms back then was her high levels of anxiety, because she couldn't go anywhere. So we couldn't take her to a restaurant or to a mall or to play outside. And it was devastating because anywhere we would go, try to take her, she would scream and she would bite her wrist all the way up to her arm and pull out her hair. And so we never left the house, and it was very painful. By then, she was 4.5, almost 5, and we had tried many different therapies, conventional therapies that would come to our home because she couldn't leave our home. We tried hyperbaric chambers, we tried the diets, we tried fecal transplantations, we tried IVIGs, you name it, stem cells. We've tried so much, and it was always as if she would take one step forward, 2 steps back. So that was when our doctor recommended, you know what, go to BTC, try MERT, try for a week, let's see what happens. So we were on the plane the very next day. And when we got there, we were explained that we were going to do a 1-week trial and see if she would change. And anyway, so the first day they did an EEG on Raquel, and what they found in that EEG was amazing to me because they validated what I was seeing at home. It's one thing to know that your daughter's autistic and to see all these behaviors, and it's a different thing when a doctor sits with you and explains her brain to you. So I was able to see or get a glimpse as to why Raquel was in this survival mode, why she was so afraid of living or of life. And I was told she just simply wasn't seeing the world the way it was. Her brain was not processing the world. So she was terrified to live in it. And I was always wanting her to talk. And the doctor said, how do you expect her to speak when all the neurons where her speech should be are turned off? There is no activity there, and her processing is suffering right now. So we started the treatment, and day 2 of the treatment changed my life. Here's how it went. So we get in the car to go to BTC, and it was about an hour ride, and she didn't scream, she didn't cry, she didn't bite herself. And I remember me and my husband, we were holding our breath because we thought any moment now she's going to lose it, and she didn't. We went to BTC, and she actually walked in calmly and sat down in the same chair she sat down the day before, and she allowed the tech to do the therapy, and she enjoyed it. And there were so many sounds everywhere, and screaming from other children, and phones ringing, and she was okay with all of it. And I felt like it was the first day in her life that she was actually taking in information correctly, and she was appropriate, and she was doing well. So that day we get back in the car, we are already amazed at how she's understanding everything. And so, for example, she would usually, once she stopped crying, she would usually just stare out blindly, like through the window. And she wasn't doing that day. She was actually actively looking outside the window and seeing the trees and looking at the sky and pointing at things. And to us, it was an eye opener. So we get back to where we were staying, and she comes up to me, and I'm with my husband in the kitchen, and she gives me a little cup, and she says to me, "Give me more juice." And it was the first words I have ever heard from my daughter's mouth. And it was after 2 days of just connecting her brain, and me and my husband could not believe what we were seeing. And we started filming her and questioning her and challenging her. And what we saw in that month of treatment, because we decided to stay for the completion of the treatment, which was a whole month, she started to follow instructions. So I could ask her, "Raquel, go get the shoes and bring them here," and she would do it. She started to look people in the eye. Her anxieties dropped to 0. We were able to go to the mall. We were able to go to the park. We even took her to Disney. I mean, me as a mother, it was one of the happiest moments of my life. But around week 2 of treatment, something short of a miracle happened for me as her mother. She came up to me and she asked me to pick her up, and which was very weird. Raquel didn't love being touched or being held. And I picked her up and she looked me directly in the eye and she parted me by my shoulders and she went, like she shook, and then she hugged me. And then she parted me again by my shoulders and she shook again, and then she kissed me. And that went on for like about 15 minutes, and it felt like days to me. And she was very black and white. She was getting to know her mother. I am her mother. And at that one moment, it was as something just clicked and she realized, oh, you're my mom. And it was the most beautiful moment of my whole life. And I felt her born again. She wanted to sleep in my bed. She wanted to use my makeup. She wanted to put on my shoes. It was the most spectacular day of my life. And all of these things started to happen. She started to have a relationship with her sisters. They started to have fights over things and toys, and she would tease her sister. She just became a part of our family. And it all happened after this therapy seemed to connect things in her brain that were disconnected before. Because, you know, I was shown different EEGs throughout her process about how she was progressing. And the more waves became appropriate, the more brain processing she accessed, the more she would give me as her mom, and she would see the world as it was. And honestly, I would recommend this therapy, or at least try 1 week to see how it goes for your child, because in my experience, it saved our lives. And I did bring you guys some videos, and I want to tell you a little bit before I put them on. One of the videos is of her at home with me and her therapist. And I initially filmed this video because I thought, oh, this is a good day for Raquel. She's not screaming and crying. But going back to it, I got to see how compromised she really, really was. So this video is before we even touched her with MERT. And I remember it was 3 months before we went to the Brain Treatment Center, this video. Right after this video, you're going to see a video while we were at BTC, after her first, I think, 3rd or 4th session. And I want you to notice and appreciate the difference between what she looked like 3 months prior. And they're very short little clips, but I think you'll be able to appreciate it. And then the last video you're going to see is just what my daughter looks like today. And I'll tell you, Raquel goes to a regular school. She has a shadow, but she does amazing in her classes. She's actually above her grade in math. She has a friend. She's social now. She can do school plays. There's just so much that I thought she was never going to reach, and she has. So I'm so thankful to this therapy. And well, I will go ahead and let you look at this video for yourself.
Y la cabeza, abre la cabeza. Enséñame la cabeza. ¿Dónde está? A ver, ¿dónde está? ¿Dónde está la cabeza? Ah, ¿dónde está? Ah, ¿dónde está? ¡Ay!
Now, after 3 months, we went to BTC, and the next video you're going to see is what she looks like after 4 or 5 days of therapy.
Di, Marcelita. Marcelita.
Marcelita.
Papá, te amo.
Papá, te amo.
So you can tell in these videos, Raquel has become verbal. 3 months prior, she wouldn't even say one word. She would just hum the way you heard the video say, and she would rock back and forth. This is her 4th or 5th day, and she is repeating words, and she can be understood. And now here's a video of her giving an explanation, or basically a presentation at school. Now, mind you, Raquel is a Spanish-speaking child. And the presentation you're going to hear is her giving her presentation about Hillary Clinton in English, and for English class, but she's actually a Spanish-speaking child.
Tranquila, Raquel, tranquila.
Good morning, teacher, parents, and classmates. I have the pleasure to present my speech about Hillary Clinton. I was born on October 26, 24/7 Chicago, Illinois. My parents were young adult problem. I grew up in the suburbs. My dad had a small business that made curtains. I went to East High School, then I went to Jala. I married Bill Clinton. I was slaughtered at Roswell Farm. I daughter called Chelsea. I published my first book, Ethics and Foolish.
So as you can see, she has a little bit of an accent, but she's doing it, and she's doing it by heart. The original speech is around 5 minutes long, so we're not going to share the whole thing, but you can appreciate how she can memorize, stand in front of a microphone, articulate, and I'm just the proudest parent in the world. And from the bottom of my heart, I tell you, try it for at least a week, see what happens with your child. It's safe, it's non-invasive, and it makes so much sense. Thank you so much for your time. You're on mute, so I'll go ahead and do it. Go ahead.
I think we're ready to open it up for questions now.
Yeah.
Wow, how inspiring, how inspiring. Thank you, Sandy. Thank you, Alex. Thank you, Miriam, for sharing your information, your education, and everything else. Now, Sandy, I was supposed to invite you to the front of the stage. Look at you. You're just so anxious to get up there and start answering questions. I love it, though. So, guys, what we're going to do is we're going to go ahead and open it up for questions and answers and have the panelists come up and field some questions from the audience. So if you guys can, there should be it's okay, Sandy, go ahead, come on up. There should be a little link at the top for you to turn on your camera. Excellent, there you are. Just so eager to answer questions, aren't you?
Yeah.
Absolutely, absolutely. So let's get Alex up here. How's it going, Alex?
Hi there, going well.
And Miriam, there we
Hi.
go. Hey, gang, good to see you guys. Absolutely.
Yeah.
Thank you guys so much. So here's how we're going to do it. We've got a whole bunch of questions have been sent in through what we call our question box. And I'm going to share my screen, and it's going to show the most prominent or most interesting question that people have voted to the top. And so we don't have a whole lot of time. We've got maybe 10-ish minutes or so. But we'll try and squeeze as many questions in here as we possibly can. I'll start out with Sandy since she kind of opened up the presentation, and we'll run through a couple of questions from Sandy's box, and then we'll jump over and go to Alex's questions. And Miriam, if you want to jump in and chime in with anything, just boot them out of the way and share your story.
Sounds good.
So let's just, and I'm going to minimize me because they don't want to see me anyway. So audience, if you can, we don't have time for all the questions because we got a lot of them. Go through and upload the questions that you really want to have them answer the most, because we're going to try and run through as many as we possibly can. So let me share my screen first, and we're going to jump over here to, let's see here. This is Sandy's first. And let me know if you guys can see all see my screen. And when you guys give me the okay, I will then disappear. Does everybody see the screen? Yes?
Yeah, we can see it.
Okay, perfect. So don't start yet. I'm going to go ahead and turn and mute my camera. My mic will still be on. So if you guys, are ready to advance to the next question, it's kind of give me a verbal signal. I'll move it to the next question. And then after we do a couple of three for Sandy, we'll jump over to Alex's box. And it's an open forum. So if anybody wants to chime in, you're free to do so. And I will get rid of me and let's start here. If you want to read the question, everybody sees it. So if you want to read it, that's fine. If not, totally up to you. Kind of like a hot seat.
All right. So the question that I said, child's microbiome because of neuroinflammation, does it need to be addressed prior to treatment? It does not need to be. Just because we are addressing brain activity, ideally, if you're in the middle of some sort of other treatment where you're trying to decrease inflammation, then yes. But we're going to take an EEG anyway and see how your child's brain is functioning, and then modify or create a protocol that will address your child's brain activity at that state.
I want to chime in for a second because just so you guys know, I did take care of her inflammation, prior, not because I knew better. It just happened to be that way. So for Raquel, I was addressing her microbiome before.
All right, next question. Maybe. As I wait for the next question to come up, I am going to just say a few things that I saw as questions that came up on the chat box. There was a lot of questions about just in terms of treatment, how many treatments do you need? What kind of success rate do we see? We do offer a 1 to 2 week assessment period because we know that in all things in medicine, it's not 100%. Not 100% of the people coming through or the kids coming through will have a positive response. The majority do. In my personal experience, I do see probably 80 to 85% of kids with some positive responses with that treatment. We do an assessment period just to be able to see what kind of response we're able to get, and if this is an option for you for your child. And we do know that it does require investment of finances and of time because it is a daily treatment. And so before you commit to anything, we just want to make sure that this has value to your child and to your family.
So, Dr. Lee, this is the second question, actually.
I'm sorry?
This is the second. This is the next question, actually.
If I may, I'd like to take a read through this and answer it.
Sure.
If a child's a non-responder to other treatments like microcurrent neurofeedback or lens or neurofeedback, would this treatment help? And I think it's important to know that we're talking about different treatment modalities. That is with neurofeedback. This is where you set up electrodes that are actively reading your brainwave activity, and you have a screen, and you're trained to, in most neurofeedback cases, try to impact something in the game that corresponds to the amount of certain activities being high or low. So you're training yourself to try to concentrate and focus and change your own neuronal activity to interact with the screen. That's the feedback portion of the neurofeedback. And with the neuromodulation we're discussing, it doesn't have that interactive component. The child sits in the chair and receives the stimulation, and neurons are activated at the frequency we're putting in individualized to the patient, and they're being put on the treadmill for 5 seconds, a minute, over the course of half an hour. And as a consequence, neurons are receiving training, regardless of whether or not the patient or the child is interacting. So it allows a much more direct stimulation of neuronal tissue, and in comparison to microcurrent, which is very small, tiny current, the amount of force that's employed here is many dimensions higher. So it's a lot more powerful. So in short response, this treatment can still help, yeah, if you're a non-responder to neurofeedback or lens, because it's a different way of interacting with the brain.
Dr. Lee, would you like to chime in, or are we good to move to the next question?
We can move to the next question. I'm actually not seeing the questions appearing on the left of my screen.
They're not on the left, they're on the screen share. So if you go to the main window, You should see this screen share. Do you see that?
Sandy, I'll read the question for you.
That'd be great. I'll be easier.
Do the effects of treatment last is the question, and is there any research into long-term side effects?
Right. Good question. In terms of the durability or quote unquote the permanency, I don't like to use the word permanent, but durability we tend to see for individuals if they get a good 6 to 8 weeks of treatments, the majority of our individuals will keep the majority of changes. So we do have some individuals where they'll come back, the next year or the next summertime when when kids are able to stay here and get that daily treatment for the extended period of time. And what we see is that most of them are still retaining the good changes that they've had, and the parents are coming back because they want to continue that development or that progress of the brain changes. So I'm not going to say permanent, we just don't have data on that, but we do have pretty good durability from what we're seeing with our individuals. In terms of long-term adverse effects, not really seeing a whole lot, and Alex, you could probably chime in terms of this too, in terms of the research, but thankfully with MERD, especially because it's non-invasive, we don't see minimal adverse effects, thankfully.
Yeah, and just to add on to that, earlier this year, there was a publication on the use of TMS, which is the base technology that we are individualizing with our EEGs, the use of this 3 million applications in children. And they noted in their review of all their charts that any of the side effects that were noted, including things like headaches or agitation, on the average would drop off between weeks 2 and 3 of stimulation without any long-term side effects. So the safety profile of the underlying technology is excellent. And the approach that we're seeing it being employed in clinics is taking the standard approach and dialing down the power a bit more. So we're kind of in an even safer zone. So,
I would like to add, can you hear me okay?
Yeah.
I want to add that for me, when I only did a month of treatment to begin with, and her changes lasted all the way up to, I would say, a year and a half. So what I mean by lasted, I meant that they kept on going on. So she kept on getting better progressively. About a year and a half into it, she was doing amazing and nothing went backward, nothing. I did feel like she needed another push to get to a different level then, and that's when I repeated treatment. But her changes kept on coming for at least a year and a half after I did a 1 month treatment.
Inspirational. So guys, also if I display a question that you guys have already kind of answered in some format or some form, just say next question.
That makes sense.
Okay.
Yeah, so I think this next question is somewhat answered. How does MERD compare to treatments with Nexlin plus neurofeedback? I believe Nexlin's also microcurrent stimulation. These are direct current stimulations that TDCS, Nexlin, and the rest of it that provide direct charge on the level of battery power into scalp, and that diffuses across often. There's minimal evidence, although suggestible evidence, that it influences and biases brain cells towards firing or towards not firing. With MERD, or with this guided treatment, when we provide the pulse of stimulation, it will penetrate several centimeters into the brain and it will stimulate neuronal tissue. And that's repeatable, demonstratable, and something that occurs over and over again. So I think we already discussed that. What is your success rate in terms of symptom resolution in autism?
So I'll go ahead and address that. And as you heard from Miriam, I mean, her daughter just had a wonderful response. Depends. I mean, when you talk about success rate for here, I mean, I never say that this is a cure for autism. I mean, I don't think anyone would say that there's any cure out there right now. But what we're doing here is trying to improve or modify brain function so that the child is better able to process the things that that is going on around them, to self-regulate their emotions and their behaviors and whatnot. I think from what I've seen here at our Newport Beach clinic, and we've seen hundreds of kids with autism coming through here, like I said, I see about 80–85% of kids who do show some degree of response. For me, success is If your child comes in and they're at point A, you want them to get to point B, anything we can get them closer to that in terms of brain function, that to me is, that is good. That is a success. If we can get them all the way over or close to that, I'm over the moon when that happens. And I'll be the first one to say it's not effective for 100% of the people. And that's why we do the assessment period, so that we can identify those individuals where, for whatever reason, our technologies are not at the point where we can get to 100% success rate. But if we can get kids to have better brain function so that they can, like I said, just respond to their therapies better, respond to their different regimens of therapies better, whether it's through the standard, ABA speech OT or the different kind of programs that you guys have in place for them. That is, that to me is a success for what we're doing. Alex, anything you want to add to that?
So I'm switching screens to Alex's questions now. So there's a few from Sandy's box, and now I'm going to switch over to Alex's box, and we'll grab a few out of Alex's box.
Sounds good. Does insurance cover this treatment / therapy, or does your practice bill insurance? Ask as neurofeedback is covered when done with CBT psychotherapy. Although I'm not the insurance guy, I don't have very much information about that. I believe some insurance has, I believe you have to go to and apply for insurance coverage, and we've seen some success with that coverage, but past that, I'm not quite sure I can add more information.
Yeah, and I should probably speak on this. So first of all, there are different clinics, brain treatment centers, and clinics that work with us across the U.S. and internationally. Each clinic may do things a little bit differently. Here in Newport Beach, we don't work directly with the insurances, but if after your treatment course here, we provide you with a super bill, and then you can then on your own then work with the insurance to provide reimbursement or coverage. We've had patients come back to us and tell us that sometimes, one part of the treatment is covered, like the EEG or the doctor's visit, or even we've had a handful of patients where the actual treatment is covered. It's not routinely covered by insurance at this time, and we would love for that to change. But we've had some patients, the parents on their own, that will get reimbursement directly from their insurance after getting treatment.
Yeah. Perfect. So the next question is, has this technology been used to, there was a question about Alzheimer's and dementia up there. And it's interesting with neuromodulation, you just need to be stimulating brain tissue, and you'll see generally some sort of response if brain tissue follows along the pattern that you're putting in. So although in the clinics, we've seen some really interesting results, we're pending publication and commencing studies on these Alzheimer's dementia cases. But generally it takes about 1 to 2 weeks before we can really see if the degree of response. Although privately, we're really excited about our progress in applying MERT in these domains. Is the treatment clearing toxins from the brain or stimulating parts of the brain? What the treatment's doing is it's first we analyze with the EEG, and we look for regions of the brain that might not be talking well with other regions of the brain. And the treatment itself comes in to stimulate those regions that might be talking in a different speed or in a different way. And it patterns, we provide stimulation at a rate that matches with how the rest of the brain is talking. So our goal here is to get neurons to essentially talk in some places they might not be talking the rest of the brain well enough with, and wake them up or slow them down, basically get the entire brain to talk the same way. Think of it like a radio frequency. If in the back of your head, the radio frequency is 98.7 and in the front it's 98.5, there's going to be a little bit of disruption in your signal. Maybe you hear static. And what we're trying to do with our treatment is go to that 98.5 and tune it up to 98.7. And we do so by providing it a 98.7 signal. Now, the actual signals are between 8 to 13 times per second. But when we provide the stimulation, let's say 10 times a second or 10.3 times a second, we're telling neurons, this is when we want you to be firing and resting. 10.3 times a second or 10.1 times per second. And that is that sort of daily brain gym. Patients come in, they sit in the chair, they receive the stimulation, and after a week or two can take another EEG and see if they follow the leader, if they followed the pattern of the stimulation. So that's really what we're doing. We're just trying to have them talk more appropriately with one another. There's some discussion about the toxins in the brain and how we might be interacting with it's called the glymphatic system, but there's not been really clear research on that at this time to comment on. Question for Miriam.
Okay, Miriam, is this the only therapy you did for your daughter, or did you also do dietary and other interventions? Well, I mentioned, the first thing I did, obviously, is go to the pediatrician. I didn't get many answers there. So then I started following like a biomedical trail to doctors that were doing the gluten-free, casein-free diet, giving the prebiotics, doing the supplementation. And I started that. That was the first thing I did. What I noticed in my daughter was that she started to get a little bit chubbier. She was really, really skinny and bony and had a very bad like underlying bags in her eyes, and that started to get better. But her autism symptoms were still very severe. So from there, I did so many other things. I bought those hyperbaric chambers that are like home ones that you can use. I tried that for a long time. I did stem cells. I tried fecal transplantation. By the way, all these things I believe in. It's not that they didn't work. It's just for some reason at the time, my daughter was almost 5 years old and I was still seeing a severe diagnosis. She still wasn't speaking. She still wasn't understanding the world. So I did do a lot of things prior to BTC, but it wasn't until I tried MERT that I felt like she flourished. When we did MERT, it was like the missing puzzle for my daughter. So I do believe in the diet. I do believe in trying to get the gut clean with all my heart. I mean, anybody I ever talk to, it's something I always say that you should do because it's linked to the brain. I mean, it just makes sense. But so I recommend you to try anything that you feel could help your child. But for me, MERT was the ticket. I hope I answered your question.
All right, so the next question is, I'm a MAPS, M-A-P-S provider. Where can I go to learn more about this and offer this in my office? You can visit braintreatmentcenter.com. There's contact information there, and if you just connect with us and contact us, we can discuss how to employ MERT in any office or facility. The goal here is to not only provide access to those who need it and want it at the clinics that currently exist, but also expand this to help more. The next question is, can you modulate very high beta waves? It's an interesting question. So talking about brainwave activity earlier, there's slow brainwaves that occur when you're in deep sleep, delta and theta, and there are faster brainwaves, alpha and beta, that occur when you're awake. There's also even faster brainwaves in gamma. It's faster than beta. Basically, beta activity corresponds to waking brain function, how we are right now as we're talking, interacting, and working and taking in sensory information. So the treatment itself focuses more, a little slower than beta in the alpha range. But what we do find is when we're starting to reinforce this brain clock rhythm, it takes away from neurons working in other ways. So if there are neurons that are working a little bit too slowly while you're awake, in theta, what we see when we see response to treatment and more of this brain clock activity with treatment, the slower activity speeds up. So you no longer have that very same slow activity. Beta activity is a little less responsive, but from our perspective, if we can reinforce this brain clock activity, it allows you basically more fuel in the tank to take advantage of the attention, awareness, and presence that is correspondent with high beta waves. So with this neuromodulation, the beta waves are less sensitive, but our goal is to provide tools to take advantage of them, which is what we tend to find occurs for those who can respond to treatment. Yeah. So I'm seeing a few questions in the chat as well, as far as locations and whatnot. You can visit braintreatmentcenter.com to find the locations. There aren't any facilities in Europe yet. Next question is, what is your success rate? This is for you, Sandy. What is your success rate in terms of symptom resolution in autism?
Right.
And we might have discussed this,
And I
but
think we
please.
discussed that earlier. Yeah, and part of it is, again, what is it that you're particularly looking for your child? I mean, everyone comes in, every child that comes in has different symptoms, whether it's, and at different, they're at a different function, of course. And so we do see a reduction in some of the symptoms, whether it's stimming or whether it's, or an increase in eye contact or listening response. So we do see, changes, positive changes in most of our individuals that come through here.
If I may add, we ran a small pilot with CAR scores, Childhood Autism Rating Scale, and we found that the biggest categories to respond initially were items, I'll list the items and what they are: 2, 3, 4, 5, 6, 9. Imitation, emotional response, body use, object use, adaptation to change in taste, touch, smell response. Basically, awareness of the environment, which corresponds to activity in the back of your head, proprioception, and where we are kind of, our hand is in space, and how incoming sensory information is being received. That tends to be the first thing we see response in, at least via these small little pilot studies. And things like high order function, they need a foundation to be built up on. So if you can build a sensory processing foundation, then we start getting these high order function also changing. I have another question here, Sandy. It's to you. Is anterior and posterior asynchronous cause or consequence of development of ASD? How are the clinical results explained with MERT? I think I might want to take a stab at this, because if this is referring to EEG activity, asynchronous EEG activity, if this is the cause of or a consequence of the development of ASD, that is what we were talking about earlier, how we note, and it has been published and it's known in research, that you develop this brain clock rhythm normally in ASD in the back of your brain, but its coherence with the front, how well it's connected to the front, is at deficit. I wouldn't say it's necessarily the cause of ASD. We don't really, still good research is ongoing to determine cause. However, we do see the same disruption of development of function, asynchronous EEG activity, and other developmental disorders. So not just autism. So we know that it's a consequence. However, we don't necessarily believe we believe brain activity is linked with the non-development dysfunction, and we're just measuring that. And I kind of went over some of the clinical results with MERT, but our goal here is to change EEG activity, or change neuronal function. And what we tend to find is if we can change that neuronal function, that's when we'll find symptoms shift as patients are now more well able to take advantage and understand sensory information.
Right, and then maybe just one thing to also clarify, like I said, that disruption in that frontal alpha activity, it's a pattern that we see pretty consistently with our patients with autism. And like Alex had mentioned, whether or not, the cause of it, or is this causes the autism, or is this, a byproduct of the autism? I think that's a much larger question that, from the scientific community, we're still trying to figure out. So, yeah, but good question.
Great question. Hello, Dr. Lee. Well, you have a clinical study of MERT and ASD. I would like to educate patients about this.
Yeah, so we've had some smaller in-house studies that we've done, and we are actually looking to, it'd be great if we can actually do a third-party study, because it's fascinating what we're able to do here, and we would very much like to have a study kind of put out there, kind of a double-blind placebo third-party study. So yes, I would like to very much see that happen.
Yeah. So outside of the pilot studies we've run, we're looking for partners on larger studies. Next question is, how has the therapy changed or improved from 2014 to this day?
Good question. Alex, I'll probably defer to you since.
Okay, yeah, sure. So our big strength is that we're focused on the EEG component, on the brainwave aspect, and our analysis has grown and developed from 2014. We started really looking at this as a project in 2009, so it's about 11 years now, and we've developed further EEG insights. How we're providing therapy, the algorithms behind it have also been updated in terms of stimulation and where we're providing stimulation. So we're really seeing better guidance, I think, and more reception in terms of where we're stimulating from 2014 to this day. Just to step back real quick on the studies, we are also looking at launching a genetic study at Texas A&M with autism and MERT. So that is on the books and is something we're really excited about this year.
Okay, guys, we have probably just a couple of minutes left, so I'm going to finish up with a few from Alex's box. So if you guys want to kind of do a lightning round with these last few questions, feel free.
All right, question. Can you use a prior QEEG to determine if whether a child would be a good candidate for this therapy? Ideally, the EEG, there are different systems. We like the system in our office in order to have it be compatible. However, we're always open to looking at medical records if we can schedule an appointment. Ideally, it's with our own system so we can provide clear and clean insight. But generally, we find that most who go through the 2 weeks can find some degree of response by the end of those 2 weeks. So we're real excited about just offering that. Let's go to the next question. Can brainwave frequency music corresponding to the time of day and what level of activity a child should have regulate children positively? It's interesting, you can insert neurological oscillation frequencies. It's called binaural beats in music. I think that's what this is asking about. Although I haven't read any studies or trials that indicate that binaural beats are necessarily helpful or effective in modulating brain activity. I would certainly say I don't think they're harmful. So I don't, ideally we'd want to modulate these at the individual's own brain clock, individualized brainwave frequencies. I've certainly seen patients with this after they go through MERT treatment, and it helps keep them calmer. But I don't understand quite right now how well it can modulate brain activity and thus impact function. Let's go to the next one. How can we find local practitioners who provide MERT? You can go to the website, braintreatmentcenter.com, and it shows all current practitioners, licensed practitioners who have the MERT technology, and you can just give them a call and go ahead and schedule an appointment or talk with someone if you have further questions.
And this is the final question, and then we'll close it out, and I'll let you guys all have the last word.
Sure. The question is, did you have success with kids with psychiatric issues, PANS, in addition to ASD? PANS is not psychiatric necessarily, but it's autoimmune. We started using this technology at UC Irvine Center for Neuropsychiatry. So we started in psychiatric conditions and schizophrenia and others, and we did find success, and there are published studies on those successes in reducing the negative symptom profile of schizophrenia. We do use and see patients who are coming and presenting with other things, such as anxiety or depression, and we tend to find that they feel and respond fairly well. But of course, that's pending studies and results. But yeah, the majority of the individuals who are coming in tend to be more related to ASD.
Excellent. And then I stopped sharing the screen. There is one extra question that just kind of popped up. Have you seen progress in adults as well as kids?
Yeah. Yes. I would say in autism and non-autism. And as Alex alluded to, in our clinics here, we're not just seeing children with autism. When you come here, you'll see that we've got adults, we've got adolescents, kids, and with a myriad of different diagnoses coming in. As you can imagine, because we are improving and modulating brain function, if there's anything that an individual struggles with that involves their brain activity, we get their EEG. We look to see if it's how those neurons are communicating and looking at ways to optimize it. So I would say yes, adults, we do see improvements in a lot of our adults. And like I said, in adults with autism and in our non-autistic adult population.
Excellent, excellent. Guys, thank you again so much. It was such a pleasure to listen to the stories and to get the information and the education, despite the unprecedented circumstances that we find ourselves in. And I would like to just extend the appreciation on behalf of Ed and Terry and the whole group at Autism One for you guys taking the time out of your day to participate in this virtual summit, even though we can't be there personally. Now we're still making sure that the information gets out into the hands that the people that actually need it. Let me ask real quick, have you guys had a chance to visit the virtual networking hall at all yet?
Not yet.
Not yet? Well, if you go to the homepage and click on the virtual networking hall, it's a great way to engage and interact. And folks in the audience, if you want, go over to the networking hall as well. And if you guys want to go and sit down on a couple of the virtual couches and continue to field some more questions, by all means, I encourage you guys to do so. I'm going to let you guys each go take a little round robin and take the last word. I'm going to disappear and you guys close it out.
Yeah, I want to encourage everyone to come to our virtual booth with questions that you may have. I know that we didn't have time to address a lot of the questions, and there were some from just logistical standpoints with cost and whatnot, and things have changed over the past year. So please go to our booth with questions. You can always reach us at braintreatmentcenter.com. I just thank you for coming to our talk. I wish everybody well. Stay safe, please.
I want to echo Sandy's sentiments. This is a wonderful forum for us to discuss interesting and new technologies. Thank you for your attention, for your time, and we're all excited about the future when it comes to all research in this area. As far as what we're discussing today, if you have further questions, you can email us info@braintreatmentcenter.com or check out the website, braintreatmentcenter.com, for locations and additional information. Great having everyone here. Thank you for your time.
And as for me, I want to thank you for the opportunity just to tell my story. I'm going to try to go to this virtual lounge and see if I can reach out to any of you that might, as a parent, want to know what it's like on the other side. But I encourage you all to try it. You know, we have, as parents, we look every day for things, but in my experience, very few therapies actually let you try it out before committing fully to it. So, you know, you try it for a week or two, and if it works, you know, you stay, and if it doesn't, at least, you know, they're truthful about it. So I'm very thankful to BTC and everything that they've done and the opportunities they've given my daughter. We'll see you.
Wonderful, guys. Thank you so much. Have a wonderful day. Be safe. And I'll see you guys over at the virtual networking lounge. And Nina, if you're having issues getting into the virtual networking hall, you might want to either reset your browser or refresh your browser, I'm sorry, and try to log in and at that particular point as well. Thank you guys so much. Have a wonderful day. Bye.
Bye.